They're sending someone up, so hopefully. Hey, I cannot get that thing to work. All right, well, whatever you did, thank you.
You good otherwise, or?
I think I'm good. Just gotta get in here.
Okay. I gotta make sure, okay?
All right. I think I'm in. How is that even possible? Network login?
Don't forget your X with the
Yeah.
Oh, that's always when a computer only log on.
No, you don't.
No, network log on, right?
Yeah.
Yeah.
Should I have the X?
I think at least that is much of
So they can't see you typing.
Yeah. We should be good.
Doesn't work, you gotta reboot it, I guess.
Okay. What the hell?
Now get back to correct.
All right. Thank you for coming up. I appreciate it.
Sure. I actually had to go back to I went up here, the guy told me 323. So I went up here, I looked at 323, their projection was just fine. Went all the way back to the first floor.
I called
Asked the
right
guy.
away and I said, actually 322. And he's like, yes, you already set him up. I'm thinking, wow.
Yeah, but either way, I'm kind of winded. I hit the stairs twice.
That's good. That's super cardiovascular healthy.
Yeah, I know.
You'll live longer.
Right? I'm due for a lunch like 5 minutes ago.
Oh, man.
I got issues in 349. I broke 3 of the laptops, but this.
You broke these? Oh.
Yeah, interrupted my image.
Sorry to hear that.
Yeah, so all sorts of stuff on my plate at the moment, but we'll get this knocked out.
Does anyone want or need another name tent? I have more. If you lost yours or forgot yours, I have.
Have a different backpack today.
Yeah, that's fine. Suzelle. No. Alexandra. There. Victoria. There. Sale. No. Alondra. Jennifer. Aldo. Aldo, you're not here. Okay. Jennifer. Not here, so also here. Jennifer's here. All right. Lilia? Oh. Samuel. Lewis. Jenner, you're here. Jocelyn. Jocelyn, no. See. Kate. Randolph. John. Jeneth. James. Kenya. Kimberly. Joshua. Carmi. Kimberly. Okay, full class. All right, we should be. Yeah, I was able to log in, so we should be good. Thank you for. Yeah. Enjoy your lunch, man. Oh my gosh. Enjoy your lunch, yeah. All right, so we're definitely starting with presentations. I looked earlier, so I saw a lot of emails, so you're all ready to present. Who wants to start? Or I can go in the order that you guys sent them.
Yeah, that'll be fun.
We can do that.
No, I'll start.
Do you want me, Victoria? Okay, cool.
I'm nervous. More like sideways.
We're going to be kind to Victoria.
Do I have to stand up and like go over?
Sadia, yeah.
I'm so nervous.
So we got that
I
one.
talk really fast when I'm nervous, so I'm gonna try not to do that.
Try not to do that, yeah.
Okay. Yeah, it's a judgment-free zone, girl.
You want me to do the DJ in here? And I'll just
Oh,
like cue in the slides?
oh, yes, please.
Okay, talk to us. Everybody be kind to her. Try to be.
Okay, so my name is Victoria, and I'm doing a presentation on hypersomnia and microsleep. So first we're going to start off with hypersomnia. Hypersomnia is a condition in which you feel exhausted throughout the day. It occurs it occurs even though one might get a healthy amount of sleep or even more. And then the causes could be narcolepsy, sleep apnea, Parkinson's, head injuries, and depression. And then treatments could be calcium, magnesium, potassium, or sodium oxybate. And then can't really ask for management, but there was management included, and so management would include having a consistent bedtime routine, and then avoiding caffeinated drinks or alcohol. And then there's also, I think it's recommended to seek professional help because there's other things that could be causing hypersomnia, such as mental disorders. So that could be depression, anxiety, or just stress. And then the biology behind hypersomnia is it's a neurological disorder that is caused by the regulation of wake-promoting and sleep-promoting systems in the brain being disrupted. It also often involves an imbalanced neurotransmitter and altered brain stem function. And then side effects, they could include anxiety, headaches, loss of appetite, memory issues, sleep paralysis, difficulty waking up, decreased energy, repeated episodes of intense exhaustion throughout the day. And then side effects that are leading into other areas in your life. It's literally everywhere because it literally affects everything because you're not getting the sleep that you need, and you're just always tired. You don't have any energy. So this affects your school. This affects your work because you don't have that much productivity. And then on top of that, it also affects your social life, so your relationship with others, whether it be platonic or romantic. You're not following up with your responsibilities at home. You're just not all the way there all the time. And then the psychological and physiological causes. So for psychological causes, we have depression, anxiety, stress, poor sleep habits. And then for physiological, we have narcolepsy, sleep apnea, obesity, genetic predisposition, and blood pressure. I spelled medication wrong.
Fix it soon.
And then it can be hereditary. Hypersomnia can be hereditary, and I'm sorry, I don't know. I repeated it. But it does happen in it is possible for 1 in 3 people have hypersomnia because it is hereditary and their family has history with hypersomnia. And then diseases that hypersomnia can lead to are cardiovascular disease, high cholesterol, heart disease, and high blood pressure. And then the recommendations that your doctor would give you to prevent it would be, again, having consistent sleep schedule, getting healthy amount of sleep, avoiding alcohol, caffeine, and then again seeking professional help. And then moving on to microsleep. So microsleep is a sleeping disorder in which there are small brief periods where sleep lasts up to 30 seconds. Causes could be, the most common cause of microsleep is sleep deprivation, but there are also other things including alcohol, medication with sedative,
Sedative.
Sedative, or hypnotic qualities, and then working night shifts. And then treatment, because microsleep isn't really, it's not like a disease or anything, it's just a sleeping disorder, there isn't really a specific treatment. So your doctor is most likely going to try and check your medication in case your medication is causing you to be drowsy, or I'm pretty sure they'll having any other medical conditions that are causing you to be sleepy. So that would be just any other sleeping disorders, just like apnea or other stuff. And then the biology between microsleep is a short-term disruption of sleep-like brain activity. It occurs when sleep pressure overwhelms the brain arousal system, which causes brief shutdowns of the brain's neural activity. And then side effects are blinking slowly or constantly, having trouble containing any information, and then jolting awake, like when you're sleeping, and then you're like, oh, like that, and then yawning excessively. The physiological and psychological causes. So for physiological causes, it's sleep deprivation, sleep disorders, alcohol, taking sedative medications, and then like jet lag. And then for the psychological causes, there's mental exhaustion, boredom, anxiety, depression, and stress. And then your doctor would most likely recommend to you, like if you are like suffering with microsleep, it's like the same as hypersomnia. It's just you want to have a better sleeping hygiene, so you want to sleep early, or you want to make sure that you have a consistent sleep schedule and that you're getting a healthy amount of sleep. And then you should also learn how to not rely on stimulants such as caffeine, and then avoiding medications that make you drowsy. Thank you.
All right, smart. Crushing it. Keep going. Good job.
Okay, then thank you. Okay, then here we have stimulants and depressants. I think I was supposed to give a definition, but I don't.
Tell us what that. Do you have it? No. Keep going. Okay, we're good.
Okay, so how do stimulants chemically affect the brain? Chemical effects that stimulants have on the brain include the increasing of neurotransmitters such as
Norepinephrine. Norepinephrine.
Norepinephrine. That almost there. Dopamine and serotonin. This is done because stimulants block the reuptake process of the neurotransmitters, or by forcing a release from storage. This also allows for an increase in brain signals, such as motivation, alertness, and I wrote motivation twice. Oh gosh, it's okay.
It's okay. You can fix it.
I was a little tired reading this. And then,
Which is why sleep is important, right,
sleep is
everyone?
so important, yes. Okay then. These are the side effects. So the direct side effects include an increase in your heart rate, high blood pressure, headaches, insomnia, nausea. Right. Dry mouth, increase in body temperature, and then the indirect side effects include chronic anxiety, weight loss, addiction, formication, and fatigue, hallucinations, and agitation. Wait, do you know what formication is?
I might have to look it up, to be honest with you. I've never.
I like saw it and I was like really fascinated. I was like, I've never heard of that before.
Tactile hallucinations.
Okay, then.
Like things crawling on
Oh
you.
yeah, they think that
Tactile
like, bugs
hallucination.
are inside of them.
Yeah.
Yeah, it was super weird. Okay, then. Sorry, I just felt the need to point that out. So I was like, pretty. And then the risks. There are many risks there's many risks, but it's not limited to these specifically. So it's loss of appetite, insomnia, weight loss, headaches, and high blood pressure. In cases of misuse or like high dosage, there's higher risk for heart attacks, seizures, or stroke. And then moving on to depressants.
So stimulants stimulate the system. Depressants depress the system.
Yeah.
You guys want to cut us in, or yes? Okay. Good.
Okay, then, so how do depressants chemically affect the brain? Depressants increase the activity of the gamma
Aminobutyric acid, or GABA.
aminobutyric acid, GABA. This is basically a primary neurotransmitter that is located in the nervous system, and it's a calming agent for the brain. When the neurotransmitter has an increase in activity, it leads to the brain energy being reduced, which causes feelings of relaxation. The side effects, the direct causes are slow breathing, sedation, drowsiness, lowered heart rate, memory loss, and unconsciousness. The indirect causes include addiction, seizures, hallucinations, extreme anxiety, an increase in depression, and suicidal thoughts. The risk, there are many risks when it comes to taking depressants, including but not limited to the following: an increase in depression, suicidal thoughts, and dependency. An increase in depression, suicidal thoughts, something I just want to add, It was like, I remember a while ago, my sister was taking antidepressants, and I remember when we were talking to the psychologist, like my mom was kind of like confused. She was like, how could this cause this if this is supposed to prevent this? And so basically this kind of happens when, or it can happen when you're taking the medication for too long, or you're taking a dosage that you're not really supposed to be taking. But I just think it's kind of crazy how it could happen when it's literally supposed to be what it's kind of preventing. But yeah, and dependency. And if it's taken in larger doses, there's higher risk of low blood pressure, slow heart rate and breathing, and a lack of coordination.
It's interesting you mentioned that because it's controversial, but there's been people that have been on decades of depression medication and not gotten over depression, and then controversially taken psilocybin as a microdose and not had depression anymore. Psilocybin, like what's in magic mushrooms, it's very controversial and the research is very new, but they have had people take psilocybin or their supervisors, not just going out to get high, like just to be clear about the storytelling, and then they don't have cases of depression anymore because it's actually much safer than a lot of the drugs that they give people that form the addictions. So it's newer stuff. There's a podcast on it that's about 30 minutes that talks about it, but there's some science behind psilocybin being a treatment for depression. It's incredibly controversial and incredibly new, but they have found some effectiveness where the people were literally decades on antidepressants and then had a trip experience from the psilocybin and completely reported no depression anymore. It didn't work for everybody, but it worked enough in terms of effectiveness that they're considering that, and the FDA a few years ago approved some psychedelic-based antidepressant medicines at our government level, which is interesting. Yeah. See? Easy. It's literally that easy.
Okay, thank you.
Okay. Yeah.
Well, I was like very little and I always like struggled with mental health like back then. And so they would put me on antidepressants when I was like, I want to say 12 or 13 till like for 5 years. And it felt so horrible. Like it didn't help me.
Yeah.
And then I stopped. And then I feel better, obviously.
A side effect of some of the medications
It was
is the illness. Some
Yeah.
antidepressants lead to more depression, which I'm with you. Why the hell would they prescribe it if it leads to more depression? That doesn't make any sense.
Yeah, and then they would say like, oh, well, this next medication will help the first one you're taking, so you'll be fine and balances out. And I was like, oh, okay.
So I can do the slides for you guys, or you can, whatever's easier for you.
You can do the slides.
Okay, all right, that's fine.
How do we do the slides?
It's the arrow button right here on the keyboard.
Okay. Yeah.
Sure. All right. All right. You can drive. Cool.
Oh, do we each want to drive our sections or?
Okay. However you'd like.
Is it the down one or the next
Down
one?
one.
Okay.
Yep.
Okay, so I'm Kate.
I'm James.
Ziki. And we're doing neural disruptors, insomnia, narcolepsy, marijuana, and MDMA.
Or ecstasy.
Yes.
Okay, so insomnia in short words is the inability to sleep or stay asleep, get restful sleep, I guess. It can be caused due to stress, poor sleep habits, and mental health. Some treatment is create a routine that works for you. And for short-term insomnia, physicians may prescribe sleep medication, but for long-term insomnia, they say that it stops working after a while, so you kind of have to go more towards, they mentioned CBT, which is stimulus control, that allows you to get better sleep, which is what my next thing is. And then exercise as well. Exercise is very important. The biology is it's decreased thalamic connectivity with the amygdala and the hippocampus, and it just faster brain waves and hyperarousal. And then side effects is depression, anxiety, high blood pressure, impaired memory, and heart disease. And it can also have an effect on your performance at work, school, your reaction time, and your social life. And then psychological causes could be a high volume of stress, hormone fluctuations, anxiety and depression, and PTSD. And then physiological causes could be diet, increased food intake before bed, jet lag, and even chronic pain. And then something that they recommend is to establish or follow a good routine before bed, avoid caffeine, nicotine, and alcohol, and then learn to manage stress. And they even said meditation, which kind of surprised me because, well, that's just like super relaxing, but it freaks me out. So can't really do that. I don't know if anybody has done that before bed, but
The way meditation works, because the brain waves are similar in meditation to sleep.
really,
That's why.
yeah, freaks me out. That was my part.
All right. The narcolepsy, it's a chronic neurological disorder that disrupts sleep-wake homeostasis. It involves a sudden and overpowering urge to sleep. During narcolepsy, you also bypass stages of sleep. People that have narcolepsy can enter the REM state without going through the other non-REM sleep stages. Oh, I spelled it wrong. And it can happen as little as 15 minutes. Normally, it happens between 60 to 90 minutes to reach REM sleep. Symptoms are excessive daytime sleepiness, which is the overpowering urge to sleep, cataplexy, which are sudden episodes of muscle weakness, which is what we normally associate with narcolepsy when people just like collapse. Sleep paralysis, waking up paralyzed, fragmented nighttime sleep and insomnia, which is uninterrupted nighttime sleep or trouble sleeping. REM sleep behavior disorder, which is no sleep paralysis when you act out your dreams, and sleep onset REM periods, which is what I explained previously, entering REM super quickly. Two major types of narcolepsy are type 1 and type 2. Type 1 is the one that we hear of the most, which is related with cataplexy, which is collapsing, or sudden muscle weakness. At a chemical level, type 1 experiences low levels of hypocretin, which is a natural chemical that helps us stay awake and controls REM sleep. It is diagnosed by either measuring levels of hypocretin or through a special lab test that shows EDS. Then there's type 2, which is without cataplexy. It also experiences EDS. It's less severe than type 1. You have normal levels of hypocretin, and this one is diagnosed with an overnight sleep monitoring, and also to see how quickly they enter REM sleep. Then there's secondary narcolepsy. It's a condition unrelated to the former two types. It results from injury to the hypothalamus, which can be through traumatic brain injury, tumor, or diseases that attack the regions that regulate the wakefulness and REM sleep, like the hypothalamus. Side effects can also experience severe neurological disorders, and people that suffer this can sleep for long periods each night. The biology is, it involves the hypothalamus and amygdala. The hypothalamus, as we know, regulates the body's internal state, so here it would regulate sleep and wake cycle. The amygdala is the emotional regulation and expression. Type 1 narcolepsy, people that have this lose 90 to 95% of their hypocretin producing neurons. It decreases functional connectivity between the lateral hypothalamus and the left superior parietal lobule, which is a subdivision of the parietal lobe, the hippocampus, and the parahippocampal gyrus, which is, I think, a subdivision of the gyrus. It also decreases functional connectivity between the amygdala and the postcentral gyrus and several occipital regions. The postcentral gyrus is also another subdivision of the gyrus. And funnily enough, it increases the connection between a different part of the gyrus with the amygdala. Physiological causes, there are low levels of hypocretin for type 1. The cause for the low levels is unknown. They have seen that there is a seasonal pattern associated with the onset of narcolepsy that causes an autoimmune reaction resulting in loss of hypocretin producing neurons. It's usually in spring and early summer with the season of influenza, H1N1, and bacterial infections like strep throat. There's something called molecular mimicry. So basically, these viruses or bacteria have a very similar shape to the neurons that produce hypocretin. So the body, if you have like a certain allele of a gene, which is HLA, I think, or HLA, your body will confuse the neurons for the virus or the bacteria and attack those neurons. Brain injuries can also result in narcolepsy, and there's a very small percentage, but if you have a family history, you can develop narcolepsy, but it's very low. Side effects include obesity because a hypocretin also regulates appetite. Sleep deprivation or lack of rest leads to attempt to replenish energy with high carb and high fat foods. Physical harm as well, because sudden sleep attacks or cataplexic episodes increases the risk of injury via accidents. When you're driving, walking down the stairs, cooking, you can lead to burning. And then social and physiological side effects are social criticism. Narcoleptics can be viewed as lazy or sluggish because they can't help with their EDS or sleep. Intimate relationships also suffer. Strong emotions that trigger cataplexy. Oh, I forgot to mention that cataplexy is triggered by strong emotions. It can discourage them to seek intimacy, so they do not collapse. So they experience emotional withdrawal as a coping mechanism. It's also associated with anxiety and mood disorders such as major depressive disorder, anxiety disorder, post-traumatic stress disorder, etc. Disease risks. Narcolepsy causes no permanent dysfunction as far as like retaining your ability to speak and walk, but there is a higher risk for heart disease and other serious heart diseases. Like, I can't remember. I think that was supposed to be something else, but I can't remember. And obesity as well. You can't prevent it if you have the gene predisposition and it gets triggered, you will develop it. And once it's developed, it's forever, or for the rest of your life. It can be treated with lifestyle changes and medications. It varies from individual and the severity with which they suffer from narcolepsy. So some things are short, regularly scheduled naps, regular sleep schedule, avoiding caffeine and alcohol before bed, avoiding smoking, exercising, eating healthy and avoiding heavy meals before going to bed, taking safety precautions when it comes to driving, with work. The American Disability Association actually, what's it called? They basically work with you and your work job to be able to allow you to take naps if that's what you need to schedule during the day. And there's also cognitive behavioral therapy to help with emotional regulation if you have cataplexy.
Okay, well, kind of nervous. I made it green because marijuana's green. So there are 3 different types of marijuana. Indica, which is used for relaxation, high level of THC, sativa, commonly used for social activity, and neutralist, less THC and CBD less than most leaves, not used much for recreation. How marijuana affects the brain chemically. Cannabis has a significant effect of hippocampal structure in the younger population in the past century. Recent cannabis use is harmful to the adolescent brain. In early life use of cannabis affects the brain intelligence and socioeconomic status. And cannabis affects the brain chemically by making the body help get rid of anxiety and pain and insomnia. Side effects of marijuana affecting the brain. Decrease of performance and perception levels, short-term memory, hallucination, lack to understand concepts, and cognitive impairment. Biology, parts of the brain that are affected by marijuana. The frontal lobe, so it's memory, the hippocampal short-term memory, midterm, ventral, tegmental area, conflicts in the brain development in the hindbrain. Is marijuana a hallucinogen? Why not? I did some research and I found out that marijuana is a hallucinogen. In 1845, Baudelaire, and in 1946, Gautier of France, they were French writers. These writers just smoked marijuana non-medically and wrote about their experience of the hallucinogenic effects on the higher doses. The side effects, the direct risk the heart and lungs in the body, increase of heart rate, elevates blood pressure, increased chance of stroke, heart disease, and other vascular diseases, psychoactive effects such as feeling high, and children can experience negative health effects such as attention span, memory loss, and motivation to do things. The indirect research shows a link to social anxiety, depression, and schizophrenia, and risks failing to quit cannabis and giving up important activities of family and friends. And then we got ecstasy, MDMA. How it affects the brain chemically: impairs learning and memory, neural damage, chemical and brain damage, and alterations in neurotransmitters. Releases serotonin, dopamine, and
Norepinephrine.
Thank you. Norepinephrine. That. Side effects: increased heart rate, blood pressure, and body temperature, muscle tension and involuntarily teeth clenching, nausea, blurred vision, and excessive sweating, and anxiety, paranoia, and sometimes psychosis.
Risks of MDMA. The risks are they strain the cardiovascular system. You can experience hyperthermia, which is elevated body temperature, liver or kidney failure, long-term brain damage impairing memory and decision making, results from depleted serotonin producing neurons, and addiction and compulsive abuse. Basically, your body becomes resistant, so you want to consume more. Indirect or physical wear and tear caused by muscle tension, nausea, blurred vision, chills, and sweating. During use, you can experience anxiety, paranoia, or even psychosis. And after stopping long-term use, you can experience sleep disturbances, appetite loss, confusion, and depression.
Some of these direct and indirect effects will overlap with the risks, but I did add to the mind, it enhances sensory perception. It's a euphoric state of being and increased energy. I think a lot of people take it when they go to raves and things like that because of the music. I know they feel it more. And then bodies, increased heart rate and blood pressure, blurred vision, like how Ziki had mentioned, nausea and muscle tension. Indirect mind is depression, anxiety, brain fog, aggression, sleep disturbances that may lead to insomnia, and mood disorders. And then body would be heart damage, liver damage, and chronic jaw clenching.
Yeah, that's just exercises. Yep. Ta-da!
Who's next, guys? Who's brave? Alex, gotcha.
Alright, so drug and sleep disorders. So my first one is nicotine, and nicotine is an addictive stimulant found in mainly tobacco, and it's very hard to quit. So direct effects are causes your heart rate and blood pressure to spike, which over time can lead to strokes and heart attacks. Leads to many lung diseases, most common being lung cancer. It can increase your blood sugar levels and can lead to type 2 diabetes. It also weakens your immune system. Some side effects are mouth sores and irritation, nausea, vomiting, and sore throat. Some risks when it comes to it is smoking is the cause of 90% of lung cancer cases. Smokers die 10 years earlier than non-smokers, and 1/3 deaths from heart disease is from smoking. And I'm going to add on to my own personal story. I used to be addicted to nicotine for 2 years, my first years of high school, so I was really young. I was like 14 to 16 years old. And I guess my experience with it is that it really is addicting, and don't do it. Since when I did it, it almost became I'd wake up and then I'd get a vape and I'd hit it throughout the day. And that's all I would do. And it just became kind of my lifestyle in a way. Like, I needed it to function. If I didn't use it, I was just gonna go crazy throughout the day. And that also led to me doing marijuana as well. So it just affected everything. But luckily, I got out of it. And what I realized was the people I surrounded myself with throughout those years is what caused me to do a lot of it, since I just kind of wanted to like be in a group, and I was super young, so I didn't really understand it all. So the next one is heroin. And heroin is a highly addictive drug, and it's rapidly acting opioid. Some direct effects are slows down brain activity, causes feelings of relaxation and drowsiness, slow breathing, slow heartbeat, and small pupils. Some side effects are rush of euphoria, dry mouth, itchy skin, light sensitivity, and then some risks are respiratory failure, becoming dependent and addicted to it, brain damage, and heart problems. And then I'll add another personal story is I had a really close uncle who passed away from heroin use, and I got to see really what happened, direct effects of it. He died from brain damage, and then he had a bunch of heart problems. So another thing is don't get close to it at all, because it doesn't just affect the person, it affects the whole entire family. And then these are my sources for both of those. So sleep disorders. So my first one's parasomnia. The definition is abnormal movements, behaviors, dreams, and emotions that happen while falling asleep. So some of the causes are irregular sleep schedules, like a change in a schedule, like let's say you start working at night, or random changes throughout your day-to-day basis, and even jet lag. Your body struggles to transition from being awake to falling asleep. It can also be your genetics, sleep-wake schedule in children, chronic pain, alcohol, substance abuse. Some side and long-term effects: sleep talking, sleepwalking, nightmares, difficulty sleeping, feeling tired throughout the day, having stress or anxiety when waking up. And then there's some treatment. I guess the treatment mainly, this one happens a lot throughout children, so it's more just like the older you get, it starts to go away a little bit more. But if it's adults and stuff, start to have a consistent sleep schedule, so make sure you're going to bed at a certain time, and also make sure maybe you can wake up at a certain time to help you get through the schedule. Limit alcohol intake, and then depending on what your doctor tells you, some take medicine. It's not for everyone, it really just depends on your case. And then the next one is restless leg syndrome. It's a condition that causes a very strong urge to move legs. So the causes are, it can run your family, imbalance of brain chemical dopamine, which that just basically means that it's not going enough to your legs, so your brain can't control it happening, which is how it causes it. And then some women can get it during their first pregnancy. It's kind of rare, it really just depends on your body. And then it could also have iron deficiency and a spinal cord condition. Sometimes whenever someone has something related to it, this is also a problem they have. So some side and long-term effects are uncomfortable sensations, relief when you move, leg twitching in the night, crawling, pulling, aching, and itching. Treatment is sleep hygiene, so basically just having a good schedule. Exercise regularly. Exercise is really important. Avoid caffeine, nicotine, and alcohol. And then warm bath and massage. And there also really isn't like an actual like treatment, like, oh, you just take this medicine and get better. It's really just doing things that you think your doctor thinks will work for your body, and also just seeing what's going to help you. And these are my sources.
Xanax can also cause restless leg syndrome as a side effect.
Did you get it when you were little?
I know this because next to mine, I was trying to sleep, and then just like the legs, like, what are you doing? Nothing, I was sleeping. I'm like, knock it off.
What?
I had to get 2 separate beds and push them together so that it wouldn't be the same mattress, because the Xanax was making her move her legs while she was asleep. Like literally like kicking the legs and like just like, you're literally sleeping, like, stop. And she's like, I don't know what you're talking about. But
Don't you tell her to stop.
just trying to be arrested to teach psych courses. So, who was that? Yeah, yeah, cool. Wait, where are you? Is there a link?
Should
Did-
be, you know what I mean, your actual.
I need a link or
No, the file was there.
a file. Really?
Yeah.
I believe you. I know that.
So,
Because that's-
names.
You want to reattach it? Yeah. Okay.
Sent, and, yeah, it's there. Why is not showing? Let's see, double click on it, see what happens.
Why is not? Oh, right there. No, that's not it. I will have to send them this one.
Here it shows that it's sent.
Yeah, it's,
Did it work?
somehow it's not showing here, but it shows that I sent it to you, but I don't know why it's not showing there. So I'm just gonna share it from here, so that way,
Oh, that would work. Then we got to go like that.
yeah. So let
Just
me,
give it a second. It should.
yeah.
Now,
let me-
if you play a slideshow,
yeah, yeah.
you'll be
so-
able to see your notes.
Yes. Yes. Okay. Now we share it to that one over there. Okay. Slideshow. Start from the beginning. No, we need to send it to the other screen.
Probably presenter.
Yeah, present from the beginning.
Probably this one.
Okay, this.
You know,
Hmm?
I think presenter view will give you
Yeah.
the small one on this one and the.
Yeah.
Yes.
That's what I was.
Okay.
That's what I was thinking.
Yeah.
Okay,
work?
so we gonna be talking about alcohol, LSD, and for the sleep disorder, insomnia, and sleep terrors. And we're gonna start with alcohol.
Alcohol. It's one of the most commonly used and abused drugs in the world, and many people do not think of alcohol as a drug. It is classified as a depressant drug, meaning that it slows down the central system and reduces brain
Do you want to
activity.
read into this side?
Sure. And affects judgment, coordination, and sleep cycles. Impacts men and women differently due to body composition and hormones. Oh, yeah, it is a common term for ethanol, which is a chemical substance found in alcoholic beverages. And here is an example of how the wine fermentation, or how alcohol is made from fermentation and yeast. So fruit plus yeast, carbon dioxide and heat equals how wine is prepared, which is ethanol, and then they go through a different process for some of the distillation, like hardcore liquors like vodka, whiskey. Biology. I approach this by also separating by women and men. So according to the NIDA, National Institution on Drug Abuse, in 2023, 20% of men and 14.3% of women had a past year substance use disorder. Women experience stronger effects even if drinking is the same amount of men. Women are higher risk of liver disease, alcohol-related heart damage, breast cancer, brain shrinkage faster, higher risk of memory loss. Men are higher risk of alcohol disorder overall, aggressive behavior, risk-taking behavior, accidents such as DUI incidents, and higher mortality from alcohol-related injuries. although both experience brain effects, sleep disruptions, mental health effects, and long-term health risk. Also enhances GABA, which makes you sleepy. Blocks glutamate, reduces brain stimulation and increases dopamine, which fuels the reward pathway and which goes into addiction risk. This is also kind of how the alcohol goes through your body. So take it in, goes through intestine in your bloodstream, then to the brain, then liver and lungs and kidney. Some of the the causes are some are biological or physiological. No, psychological, meaning that many drinks can be due to emotional or mental reasons like stress relief, anxiety, depression, trauma, PTSD, or loneliness. Biological, genetic predisposition like family history of alcohol use disorder. Dopamine release like pleasure, reward pathway, brain chemistry imbalance, higher tolerance development over time, or hormonal influences. Side effects and risks. So blackouts, memory loss, brain damage, depression, heart disease, high blood pressure, liver disease, fatty liver, cirrhosis, increased cancer risk, withdrawal symptoms, tremors, weakens immune system, so when you get infections, slower wound healing, higher risk of pneumonia, anxiety, and can lead to seizures in severe cases. Recommended treatment, limit to moderate drinking, do not use alcohol as a sleep aid, seek counseling if using alcohol to cope, support groups like AA, and medical detox for heavy users. Now insomnia. The sleep disorder which is difficult falling asleep or staying asleep. It affects the central nervous system. The brain stays in a state of hyperarousal. Biology. The brain and the body show increased metabolic activity, cortical activation, and nervous system stimulation during both day and night. And according to the NIDA, this state involves hormonal dysfunction, neurotransmitter imbalance, and impaired wake regulation rather than just a simple loss of sleep. A report from Michigan Medicine Research Department said it is said that women are 40% more likely to experience due to hormonal, physiological, and social factors. While both genders suffer from difficult sleeping, women frequently face higher rates of insomnia tied to menstrual cycles, pregnancy, and menopause, whereas men often report different, sometimes milder symptoms. This is kind of how insomnia affects, just a chart of how it shows like your poor immune system, high blood pressure, risk disease, risk of diabetes, overweight or obesity, lower performance, slow reaction time, risk of depression, risk of anxiety disorder. Causes, psychological is anxiety, depression, stress, hormonal imbalance, chronic pain, caffeine use, hereditary, family history of sleep disorders, or genetic links to anxiety or depression. Side effects, poor concentration, mood swings, weakened immune system, lower work, school performance, increased accident risk, can lead to depression, heart disease, high blood pressure, substance abuse, and also cardiovascular diseases and related brain diseases, including Alzheimer's. Behavioral recommendations is sleep hygiene, no phone before bed, consistent sleep schedule, therapy, medication if needed. So basically a complete lifestyle change.
Okay, next we're going to be talking about LSD, which is a hallucinogen. And I have never taken LSD. However, the moment I learned about LSD a couple years ago, I've been actually doing a lot of research because I want to prepare a trip eventually in the future, because all the stuff I learned from it. So this is one of many drugs that would never be found in nature. It was 100% developed in a lab, and by mistake. They were doing experiments to extract different compounds from the fungi that grows in the rye plants, and by synthesizing one of the compounds, this one was discovered. But it wasn't discovered because they knew that they discovered it. They discovered it because the compound got in the nails of one of the lab technicians. And when that person went home, he realized, start feeling the effects. And when they come back the next day, like, what was that? And so basically, actually, the discoverer of the LSD, he passed away, I think, a couple years ago, 90-something years. He's from Switzerland, was from Switzerland. And so this drug alter what is called the serotonin receptors, which basically what it does is interfere or blocks the way your brain understands reality. It doesn't change your reality. It just changes the way you interpret or your brain interpret. There is something called ego dissolution, which is when your brain doesn't know what is itself and what is the exterior. So you forget that you're not, your brain forget or doesn't know how to say, okay, I am here and this is there. No, now it's just one thing. And it's a very potent drug. The consumption is used in nanograms, because I think the regular dosage, like for a regular high, is around 100 nanograms. For you to know a comparison, a cube of sugar could be like half a gram, is a billion of that, the small. So a couple of grams of that can give you a high that lasts 12 hours. So it's not really something that it could be used recreational, though in the 60s, a lot of people they call hippies were known for using LSDs and going those parties where basically they would last forever, just standing on a beach or just sitting on a park, and basically that's it. So as you see, this is sensory distortion, alter time, and synesthesia. There's something that people that had experienced it says that you can see sounds, like you can see the sound, which is again is a distortion of reality. And the reason why I said, oh, this is interesting, because I'm a musician, and me and my brother, we grew up with music. And so when we listen to music, it's not the same as the regular Joe when he's listening. And if I get excited listening, being normal, I wonder how it will feel like to really listening to a great song while you are in a state where you can maybe feel more than the regular, if you are disconnected from this part of the reality. So many people said that it has side effects: increased heart rate, anxiety, and paranoia. This is the tricky part, because again, it does not change what you're thinking, but it can amplify what you're thinking. So many people had what is called a bad trip, because if they were sad or they were scared, then that feeling gets amplified, crazy, like multiple times, and that creates a sensation that stays and it lasts for a long time. There's a risk, which is hallucinogen persisting perception disorder, is that even months or maybe years after taking the drug, you can go back into that high. Again, you only took a little. The way they distribute it is that the liquid is put in like a little paper, and like this square you put it on your tongue, and basically it goes through your system. That goes out of your system after 12 hours. But imagine 6 months later, and you're walking down the street and you start feeling these effects again. So that is a risk of LSD. So it impaired judgment because again, you might not know you're seeing something, but you might not understand what it is. So that's why it's very dangerous in some way because your whole reality get distorted. And one thing that people that had once you, the one part that is very interesting about this drug is that you cannot abuse it because the moment you take it the first time, you will never feel the same way ever again. And if you consume more, your brain will just stop kind of responding to the receptors. Like the receptor will not longer really get activated. So you're not gonna get overdose because your brain is gonna just pull it out. You're not gonna feel anything. But it is again is something that is also being used in studies for people that use PTSD, in microdosings, and anxiety. They have like some close groups of study in which they give them half of the recreational dosage and the kind of little by little, and in those studies, it shows that people either loses other anxiety disorders that they may have, or even addictions that they may have, and it helps in the way that once people go into this ego dissolution trips, once you're back, basically you understand better. Basically, that's what they said. You understand, your brain understand better where it's sitting, and somehow that helps people that have some PTSD or other disorder, like people that eat too much, people that drink too much, or people that abuse other drugs. So it has some study, but it's limited because this is classified as a Schedule 1. Is it Schedule A or Schedule 1? Schedule. The highest is there's, according to the U.S. government, there is not medical benefit to the use of this drug, but that came politically because of the 60s, how the hippies were against the war and all that, and that created a political that a lot of drugs that now are coming back, like that our studies are opening up, were prohibited, and this is one of the that they consider the one of the worst. Sleep terrors, or NREM parasomnia. This is a phenomenon that happens after you enter your REM cycle. Actually, on the NREM 3 sleep, and you're not dreaming. This is where the person appears awake, but the brain remains asleep. So basically, what is happening is that you start kind of feeling, like these sensations, like emotional stress, and even fever. Even you can't sleep. Like you like, it looks like you are conscious, but in reality, like you're supposed to be sleeping, and the problem with that is that it creates injuries and daytime sleepiness, because once you go back to your regular cycle, you wake up, but you're tired because part of your cycle was not really resting, and so there are some treatment like a scheduled awakenings. So like basically you program yourself to wake up at specific times. That way you kind of don't go into those cycles, and basically also improve sleep hygiene. Again, that includes having the same time, go to sleep at the same time every day, not having any distractions going into bed, like using the bed only to sleep, and not having any use of technology, because that kind of activates your dopamine. It kind of gets your brain more activated. So eliminating those is what is called sleep hygiene. So what this matters? Sleep and the brain chemistry strongly affect the academic performance. People that don't sleep, or people that have syndromes like sleep terrors, basically because they cannot rest, the brain cannot decompress, they cannot heal and clean, so new information is hard to be retained. And substance alter the judgment, again, in decision making. So when, let's say somebody take alcohol or for some reason make the mistake of taking LSD on a Monday, you probably will be high the whole week. So how you going to be able to function if you cannot really, if you cannot say if that's a door of a portal to a new world? Like, it's as simple as that. Like, how can you function if you cannot, if you're an alcoholic and you cannot really go and differentiate when somebody just greeting you or when somebody's like looking for trouble, which is violence is one of the effects of alcohol sometimes. So also this there have been studies saying that LSD, because of the way it prevents you from falling asleep, it also creates a sleep disorder. However, in new studies in microdosing, it says that after you pass the high, next sleeps are actually better. So some people have shown indication that yes, that whatever the unlock happen in your brain, when it kind of resets, it helps you to create a more consistent sleep cycles, which is a good thing. But in reality is when you abuse of these kind of drugs, you get chronic sleep disruption that impacts your mental health. And again, as Kimberly was mentioning, all this is connected to the biology of our bodies. And so whenever we can, we have to support safer health choices and basically educate others not abuse or consume drugs or abuse of our body by not sleeping properly. And so basically, that's some of why it matters to pay attention to these disorders and how to be careful with these drugs. So these are some of the reference, some of the stuff we talk about. We're mentioning the American Academy of Sleep Medicine and some of the journals, the National Institute of Alcohol Abuse and Alcoholism, and the National Institute of Drug and Abuse. And also there is this study made by M. Walker, Why We Sleep, and which explained, the reasoning why our body needs to sleep, what happened to our brain when we sleep, and what happened when it's affected by some of these disorders. That's it.
Who's next, guys? We not heard from yet. Oh.
Which button is it? Just the arrows?
There's the arrow down.
Okay, so this is my presentation on cocaine and Adderall by me. I'm Lilia. I can see all your faces now because usually I'm in the back. This is really scary.
Really kind.
Yes.
Supportive. Okay.
Are they the same? Are they different? The very short and obvious answer is they're both stimulants, but they do have some differences. One is recreational, the other is mostly prescribed by doctors. Adderall is an amphetamine and whatever that word says. What he said. And it's commonly used to treat attention deficit hyperactivity disorder and narcolepsy. Cocaine is a very powerful stimulant derived from the coca plant, and it was once used medically as a local anesthesia, but with its adverse effects, it's now illegal. And like I said, it's recreational, kind of. I think it just, destroys people's lives, but whatever. The direct effects of Adderall and its side effects. So according to an article by Casey Durbin on Adderall, it is a central nervous system stimulant that affects chemicals in the brain and nerves that contribute to hyperactivity and impulse control. This increases focus, attention, and awareness. Some side effects is that it is known to cause heart issues such as heart attacks and strokes if you have high blood pressure. It can cause psychosis in people with a history of mental illness, like bipolar disorder, and I think depression was on there too. It also causes a loss of appetite and sleep disturbance. From my own personal experience, yes, I was up for more than a day, and I definitely did not eat anything. So it does do that. Cocaine, I've never done this, so don't expect anything. Okay, no personal experiences here. Cocaine has a direct influence on our neurotransmitters, and according to SouthJerseyRecovery.com, cocaine does so by inhibiting the reuptake of neurotransmitters like dopamine, norepinephrine, and serotonin. And then that's just like the in-text citation. Some side effects are feelings of euphoria, increased energy, and heightened alertness. It can also cause paranoia or hallucinations. So like a lot of the videos you see online of like the guys like nodding off, like, or maybe not for that, that's a different one. But cocaine, like you see like the eyes and like the people twitch. Some people that I know that have done cocaine, they always get bloody noses and they just act crazy. So why are they both risky? I thought those little spins were fun, so I put them in there. Both can be addictive. Adderall and cocaine especially can be abused. Both can cause increased levels of dopamine, which like makes us feel happy or excited. So, once you get that feeling of feeling excited and happy, you want to feel happy, right? I mean, because all of us, since COVID, it's a little rough. We just want to be happy, right? Both can cause complications. Adderall, if misused, can be connected to insomnia. Cocaine can cause cardiovascular, psychological, and neurological damage. Cocaine is illegal, so that should be your first tell on why something is risky. It's illegal in many places around the world and in the U.S., and being caught with cocaine can bring many legal issues, obviously. Do not mix either with other stimulants. It can cause overdose or heart attacks from what I saw. And it should not be combined with psychedelics. These drugs should also not be combined with other prescribed drugs unless cleared with a doctor. This is specifically about Adderall. Cocaine, I don't think that you should combine with anything. That just sounds like a bad idea. And moving on to my sleep disorder project. So I did REM behavior disorder, which is also rapid eye movement behavior disorder. The definition is it's when an individual physically acts out a vivid, unpleasant dream vocally while violently thrashing out their limbs, and this is paraphrased from the Mayo Clinic. REM behavior disorder occurs when there are failures of the nerve pathways in the brain that keep muscles still during REM sleep, loss of atonia of skeletal muscles, or just loss of atonia. Atonia is basically while you're sleeping, your body is you don't move. So it's just a fun, pretty word that basically means you don't move. It can be caused by neurodegenerative diseases like Parkinson's, multiple system atrophy, and dementia with Lewy bodies due to evidence suggesting a very strong connection. I don't think that there was anything that I saw that said it was hereditary for either of my sleep disorders. So don't ask me about that. Your day-to-day life, how it can affect you. It can cause distress in relationships, or I don't know where I was going with that, but it was going somewhere. It can cause social awkwardness due to insecurities regarding the sleep disorder. So if somebody has REM behavior disorder, they don't want to talk about it with other people. It makes them nervous. And it can also be dangerous to yourself because your limbs, you're moving around, could hurt somebody or yourself. Some treatments that you can do if you have this. is that you should immediately talk to your doctor. It's probably number one. And then also protecting the area around like where you sleep, and like how like your bed, like you don't want to have anything sharp like on your bedside table or like in the bed. Obviously, I don't know why that would happen, but you know, just in case. And there's no specific cure, but there is lots of therapy that you can do. And then for sleep paralysis, I actually have a lot of experiences with sleep paralysis, and I've been waiting to throw this at the teacher, but the one time I asked you if sleeping on your back had something to do with this, it actually is a direct correlation. So when you sleep on your back, you can get sleep paralysis. Let's go back to this, but the definition is a REM parasomnia that inhibits the ability of voluntary muscles to move during REM sleep. So there are two types: isolated sleep paralysis, and that appears without any other signs of like other sleep disorders, so like narcolepsy I think was one of them. And then recurrent sleep paralysis is multiple episodes happen over time and can be associated with narcolepsy. The cause, sleep paralysis can be caused by irregular sleep schedules, not enough sleep, and sleeping on your back. It has also been linked to narcolepsy and mental conditions like bipolar disorder and anxiety. So me personally, I experience sleep paralysis. I'm also bipolar, and I really have bad anxiety, but I'm okay right now. Like, this presenting is pretty cool. You guys are pretty cool, okay? Other causes can be linked to drug use or alcohol. So don't do drugs before bed or alcohol before bed. Your day-to-day life and how it affects you. During moments in life when stress is high, an individual is more likely to experience a sleep paralysis episode. These can be sometimes traumatic and cause paranoia, like you're waking up from something scary. You don't want to experience another thing that's scary. Treatment can involve getting a sleep study done or medication to prevent an individual from reaching REM stage. You can reduce your distractions, so like don't sleep with the TV on and don't sleep like with your phone near you, like don't play something on your phone while you're sleeping. Keep a consistent sleep schedule, reduce caffeine intake, and refrain from drug use. And so this is what I thought we were supposed to do for like biology. So I showed you where it happens. So specifically, I'm pretty sure for the rapid eye movement disorder, it happens in that red area. So the pons, I believe so. And it's basically like where for when you go into atonia, the like what are they called? The neurons that like send signals down to your muscles for them to like stay still, that fails, and so they don't go down the brainstem, is what I'm trying to say. So the pons is involved with REM sleep. The pons helps send signals down to the brainstem to activate REM atonia. That's what I just said. And then the hypothalamus, the preoptic region specifically, and adjacent basal forebrain generate neurons that cause REM sleep. So this like kind of associated with sleep paralysis, because I know both of my sleep disorders happen like where REM sleep happens, which is kind of in both these areas. This one's a little bit different, but it's mostly in the thalamus. So that's where it's happening in your head. And that's the end, and these are my sources. Thanks, guys.
For cocaine, I remember on an episode of Botched, one of the patients actually had like a receded nose.
Cocaine's very dangerous, but it's very pervasive. Like I think it's like in the bar scene a lot.
Yeah, I guess. But it's not that the cocaine is causing that, it's the effect of you snoring.
The cocaine.
Because your nose is sensitive.
Yeah.
So
It's destroy it.
Yeah, it was like,
Yeah,
it was
because
like it was burnt.
even regular, like,
Yeah,
some people are more sensitive than other, like with the, like my third brother, when we were kids, he got a bad pneumonia or bronchitis or whatever, and I didn't know it were come out, like it was horns.
Wow.
And then like, when he healed, and when they kind of went back up, he lost his bridge.
Yeah, you have DBO symptom. There's all kinds of risks. Cocaine's dangerous, and I think I mentioned this before. If you mix cocaine with alcohol, it's really, really dangerous. There's a special chemical that gets created. It's a very long word and hard. Both cocaine and alcohol can kill you separately, but cocaine plus alcohol has a much higher risk. of that. But like I said, I think it's very like I've never done cocaine. I've seen people do cocaine. I've had people offer me cocaine. I never take it. I don't want cocaine.
It's so normalized now.
It's normalized. What were you gonna say?
When I was in high school, some of my friends, I didn't get into it, but some of my friends in the back of the classroom took some hot Cheeto dust, and I snorted it, like joking around, and they got like horrible bloody noses.
Yeah.
Yeah.
Hey.
We don't have to use the same ones that they choose, right?
I want you to pick different ones. Yeah.
Okay.
So that way it's when you do present, which next week is totally fine, we learn more stuff instead of like the same thing. So if you see it, don't pick that one.
Yeah, that's what I
Yeah. Yeah. Yep. That's totally fine. I think we're going to do conditioning add assignments and opera conditioning. Those are worksheets in the files. I'm pretty sure learning's next off the top of my head. I'm pretty sure that comes next. If that's the case, that's what we're doing. It's probably a condensed lecture. We're probably going to do a couple more presentations and we're going to do that. And that might be it. There might be some lecture on learning, but it's probably those two activities because that'll really lock that in for you guys. So do what you got to do. That's fine. I am recording and I can certainly post it if you email me or ask me to. I've recorded so far. I think I hit pause when I was talking about that other thing I saw at the bar, but I am recording right now, so. Yeah.
Thank you.
Yep, no problem.
So we're gonna just do those discussion things you said. We're gonna do those in here, but the homework, just chapter.
Yeah, I think we're gonna do that here. I'm gonna look right now. I'm pretty sure that's what our next thing is. I teach a lot of psych, so I'm pretty sure that's what's. I try to align the lectures with what you guys are doing in McGraw-Hill. So I'll just check as long as we're on break. I'm pretty sure that's what we're doing next, though. Yeah, learning, which would be conditioning, which means, well, depending on how long the presentations go, I might condense the lecture a little bit, or just do the worksheets in lieu of the lecture, because it'll still teach you guys that stuff.
Oh, I just wanted to bring something up too. So
Yeah.
for the homework, for chapter 5 homework that we did, I did the first time I got 100. Then for some reason it said I did it the second time and I got 0. But then it says I get a 50 on it, but I did it the first time I got 100.
What comes in the grade book? Did you look?
It said it's a 50%.
Can screenshot that to me,
Oh,
as-
sure. I can take a picture.
or just or email me what you just said to me, so I have a cue, so I remember.
Okay.
I can go in and I can look at that,
Mm-hmm.
and I can manually, or I can do it.
Because it's 10 to 1, I got 100 on it.
I mean, I can do it right now. Because I mean, I get it. Like I want to be fair. I want to see it.
View tab 1. What is this one? So yeah, 10 out of 10.
I mean, I can look. That's right here.
It was chapter 5.
Performance. James, right?
Yeah.
Sergeant, that's you, right?
Yep, that's me.
Chapter 5. It's just, you can see this is just your stuff.
Yeah.
I have chapter 5. Oh,
Yeah.
attempt 1. And then you did it later.
Like, I don't remember doing it again because I got 100 on it, so I'm like, why do it again?
That's so weird.
Yeah.
Okay. That, I can't, I gotta do that. Okay, can you email me or email reminder if you give me a second?
Yeah.
I might really just fix it right now.
Okay. So I just wanted to clarify.
now? Or? It's supposed to be the higher the scores. I'm rethinking grades. If the deadline didn't pass yet, that could be why. For 5, I don't think 5 passed yet. Deadline. I think that's why. I don't think you have a deadline yet. I think that's what's happening. I just resynced the grades. It went through correctly. I just resynced the grades, and it took all the points. So it was a syncing issue, which I was able to fix. Yeah, I just said please pull the grades in again, and it went back and it looked, and it took the higher of the 2 grades for everybody. I don't know why it wasn't syncing to Canvas, but it should be updated now. Yep. You get a water. I'll be right back. All I did was resync the grades
Okay.
just now.
Okay.
And I might have changed it in the beginning, but I resynced the grades because they weren't populating the canvas for you guys.
Okay.
And that probably caused a notification.
Do you drink Red Bull?
Never.
Really?
This is prebiotic soda.
It's what? Prebiotic.
Prebiotic. No, no, I don't want the caffeine or the sugar content.
So you would never drink one like sugar-free? The sugar-free one has more caffeine than the regular one.
I probably would, if I would probably drink Celsius before Red Bull.
Celsius?
If I was going to drink an energy drink. I have had Red Bull very rarely, but I'm a real person like all of you. If I decide to go out on a weeknight and I'm exhausted, I might drink an energy drink, but generally I don't. Okay. It didn't reset? Oh, it did work. Okay. Who else have we not heard from yet? Who else has a presentation? Are you willing to email to me, Alondra? Who emailed me in your? It's not you. Who emailed me in your group?
Yeah, I did. I don't know.
Did you email it through Canvas?
No. To your email.
Are you sure?
I don't know if it's the correct email that I have.
Did you do JMac1?
It's one? Oh my gosh.
JMac. That's why I never got it. It went. Someone else somewhere has your no. It didn't go anywhere. Someone else like, what is
I'm
this?
sorry. Somebody else I have.
JMac1
Okay.
at waubonsee.edu. MACK, because occasionally I get MAC. So. That's right, you drink Red Bull and energy drinks all the time, right?
So actually, I started drinking them when I was 13.
That's really dangerous, Kate.
Yeah, and then I stopped, and then we were talking about like that really toxic job last time,
Hmm.
2 classes ago. I was consuming like 2 or 3 ghosts a day. Yeah,
That's
they're like
dangerous.
people drink them for pre-workout. And then
That's dangerous.
I felt like heart palpitations.
And then you were like,
So
I
I
need to stop.
stopped.
Good.
But I started again because I don't know why. I just like the feeling gives me. Like I already have horrible anxiety, so you would think I'd want to not drink that, but
It's a dopamine.
yeah.
What do you got, James?
At one of my old jobs, I was working the night shift, and one of my friends gave me a Red Bull. I took a sip out of it, and I was like, this is disgusting. So I threw it away. He said, how was it? I'm like, oh, it's good. It's really good. Thank you.
Okay.
Yeah, it's just a regular.
All right.
Everything that I sent to you, like the older things, you would never have it because I did it wrong.
You can resend,
Thank you.
but do it soon, like,
Yeah, today.
because now we're getting like we're a solid month plus in, so just do it really soon, because now the leniency starts to go away because like we're a month in on like connect assignment stuff, because you guys should have a swing. Hey, you're still okay, just like tomorrow, tonight, like just real like soon. Don't take longer to email.
Okay.
What do you control it with? The arrows?
It's just the down arrow.
The down arrow? Okay. Yeah, I might have first. Yeah. Okay, so for my drug, I did PCP, in other words, phencyclidine, and what it does, essentially, it affects your brain chemically by altering your perception of time and distorting your sensory experiences, and it can make you feel detached from reality, almost invincible and numb. Some of the side effects of using it is it can elevate your heart rate, increase your blood pressure, it can cause seizure and it disturbs your motors. And then some of the direct effects that it can have is it can cause hallucination or dissociative effects. And some of the indirect ones are accidental injuries, since you can feel like detached from reality and you can think you're numb. It might cause you to be like, oh, I can jump from the window and nothing will happen, you know, you won't get hurt. And then another one is violent behavior. Some of the long-term effects and risk, it can lead to organ damage and dysfunction. It elevates your blood pressure along with an increased heart rate, which can lead to cardiovascular disease. And then it can cause mental health disorders such as anxiety and depression. And then it can cause difficulty in concentration and decision making. And then for the sleep disorder, I have nocturnal leg cramps. One of the causes of nocturnal leg cramps is muscle fatigue and nerve dysfunction. For the treatments, there is no specific treatment for them. Some experts recommend things like magnesium or vitamin B. In an article I had read, one of them, there was a treatment done where among like older audiences, vitamin K2 was found to help reduce them. But the biology behind it is it's involuntary muscle spasms causing your leg muscles to tighten uncontrollably, likely caused by muscle fatigue and poor blood circulation. Some of the side effects of nocturnal leg cramps can be reduced sleep, muscle soreness, and your quality of life being affected due to lack of sleep. Stress is believed to be one of the psychological causes of nocturnal leg cramps, and the recommendations to limit or prevent them is things like leg exercises, getting sufficient fluids and hydration during the day, adjusting your sleep positions, and stretches.
Okay, opium is a highly addictive, not synthetic narcotic extracted from the poppy plant Papaver somniferum. The effect of opium is very similar to that heroin. It can make you, it's like a pain reliever, and it makes you relax. This can be dangerous because opiates can be highly addictive, and overdoses and death are common. Opiates bind to an addictive opioids receptors on cell located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in feelings of pain and pleasure. When opioids attach to these receptors, they block pain signals sent from the brain to the body and release large amounts of dopamine through the body. This release can strongly reinforce the act of taking the drug, making the user want to repeat the experience. We have the central nervous system intense pain relief, euphoria, sedation, drowsiness, confusion, dizziness, and decreased consciousness.
Consciousness, yeah.
Thank you. Respiratory system, slowly shadow or labored breathing, respiratory depression, which can lead to fatal hypoxia, to little oxygen to the brain. Gastrointestinal system, chronic constipation, bowel dysfunction, nausea, and vomiting. Musculoskeletal and skin feelings of heaviness in limbs, muscular aches, and itching.
Aches.
Aches.
Muscle aches.
Thank you. Endocrine and immune system, reduce sex hormones, sexual dysfunction. Thank you. Infertility and irregular menstrual cycles, and impair immune system function. To long-term or chronic effects, they have the physical dependence, tolerance, needing higher doses, opioid-induced hyperalgesia, increasing sensitive to pain, and potential brain white matter deterioration. Another ones can be itching, pruritus, flushing, urinary retention, and a lot of sweating. For the sleep disorder, I have the
circadian rhythm disorder causes brain damage or disrupts in brain activity. An example, degenerative brain diseases, head injury, and infections that can cause encephalitis. Abnormal levels of potassium, magnesium, or other substance in the body, heart attack or damage to the hair muscle from a past heart attack. Work like people who begin working overnight shifts and might experience cardiac rhythm disorders because of the change, like the change of the life. For example, like if you are working night shift, like and then you wanna sleep on the night, you can like have a really bad disorder in the sleep. Stress and anxiety and automatic nervous system change is the switch between deep sleep and REM sleep. When dreaming causes rapid heart rate, blood pressure fluctuations, and sleep disorder breathing apnea cause oxygen levels to drop, including intense sympathetic nervous system stress, which triggers arterial fibrillation. For the treatment, there are several specific treatment modalities for CRSD. Chronotherapy involves modifying the scheduling of sleep to resynchronize the underlying circadian rhythm, so that is normally in training clock time. Time and melatonin administration. That's not too much recommendable, but they use it just like a matter like they be controlled by doctors, and reduce caffeine and maintaining a healthy weight. Medical procedures, devices, pulse markers, implantable cardioverter, defibrillator, and catheter ablation. Changing position when you are sleeping also can help. For the biology, cardiac arrhythmias includes some of the physical, mental, and behavioral change an organism experience over a 24-hour cycle. Light and dark have the biggest influence on circadian rhythms. But food intake, stress, physical activity, social environment, and temperature also affect them. Another side effects, we have the heart rate issues, episodes of tachycardia, it's the racing heart, and or bradycardia, that is a slow heart. Nighttime symptoms, palpitations, it can be floating, pounding sensation, and waking up, gasping or choking, and chest pain, which can be mistaken for a heartburn. Psychological impact, repeated low oxygen levels, hypoxia, and increased cardiac stress during sleep. Daytime effects, extreme tiredness, unintended falling asleep while driving, working, etc., and cognitive impairment. For a long-term risk, increased risk of atrial fibrillation and high blood pressure, stroke, and heart failure. And I put the sources.
And those are the ones I use in the articles.
Are there any other presentations? Yeah, Jenna. I got both. Okay, cool. You didn't give me access, so I can't. Or we can plug your.
I can plug my computer.
But I still want access so I can see it later.
Oh, okay.
But yeah, if you plug your computer in, here, you click laptop, it'll Go directly. As long as you have a HDMI out.
Right there.
That's not HDMI. Is the other side HDMI? The other side is
Yeah,
HDMI.
this
Yeah,
side.
that side.
Yeah.
Okay. All right. You should be good.
Okay.
You see what you see.
That's not it. Oh. Okay. Let's talk about drugs, alcohol. Well, alcohol and caffeine cause, effects, and treatment. What are these substances? Drug, chemical substances that change how the brain and body function, can be legal or illegal. Alcohol, a depressant that slows down brain activity. The caffeine, a stimulant that increases alertness and energy. How they affect the brain biology? Both affect the brain reward system, especially dopamine. Increased dopamine feeling of pleasure. Repeated use, brain adapts. Tolerance develops, need more to feel the same effect. Can lead to dependence and addiction. We all addicted to caffeine in the morning.
Oh, they all are. I've been trying to break my caffeine addiction for
Yeah,
a few months
I
now.
mean, I can
I
live
go-
without caffeine in the morning.
I go a day or two and then have a cup of
Yeah.
coffee.
Alcohol slow nervous system and affects GABA and glutamate neurotransmitters. The caffeine blocks adenosine, chemical that makes you tired and increase alertness and heart rate. Causes of substance use, which is gonna be stress, anxiety, depression, trauma, low self-esteem, peer pressure. Biological causes, genetics, hereditary risk, brain chemistry difference, family history of addiction. If a parent has an addiction, risk increases. Social and I can say that word.
Environmental.
Causes, family environment, friends who use substances, poverty or high stress living condition, easy availability, and media influence. Short-term side effects: alcohol, poor judgment, slurred speech, loss of coordination, risky behavior; caffeine, nervousness, insomnia, rapid heartbeat, stomach issues. Drugs, alcohol, and caffeine affect the brain and body. Addiction involves biological, psychological, and social factors. Early prevention and treatment improve outcomes. Healthy coping strategies reduce risk. Let's talk about. I think I put a lot too much pictures on this. Nightmares and restless leg syndrome. The nightmares occur during REM sleep. Emotional dysphoric dreams, limbic hyperactivation, psychiatric association. The restless leg syndrome occurs during sleep onset and rest. Urge to move legs, dopaminergic dysfunction, neurological movement disorder. The clinical definition: nightmares are vivid, dysphoric dreams occurring during REM sleep. Typically involves threats to survival, security, or self-esteem. Cause awakening and detailed recall. Distinguished for night terrors and REM, parasomnia. Recurrent distressing nightmares may meet criteria for nightmare disorder. Sleep disorders significantly affect mental and physical health. Nightmares and RLS disrupt sleep in different ways, but impair emotional regulation and daytime functioning. Understanding mechanisms improves treatment outcomes. What are nightmares? I think I went through. Causes: vivid, distressing dreams occurring during REM sleep, often involve threat, fear, and emotional trauma. Cause awakening and detailed recall, can become clinical significant as nightmare disorder. Nightmares are linked to REM sleep dysregulation, hyperactivation of amygdala, reduced medial prefrontal cortex regulation, impaired fear extinction, is strongly associated with the post-traumatic stress disorder. Psychological causes of nightmares: trauma exposure, chronic stress, anxiety sensitivity, neuroticism, maladaptive emotional processing. Nightmares often reflect unresolved emotional memory. Hereditary factors: nightmares, moderate heritability. Twin studies suggest 30 to 50%. Genetic overlap with anxiety and depression. Possible inherited difference in REM density and emotional reactivity. Consequences of chronic nightmares: short-term sleep avoidance, nighttime panic, insomnia, long-term depression, anxiety disorders, increased suicide risk, academic and occupational impairment. What is the restless leg syndrome? It is a neurological sensory motor disorder, or to move legs, often with discomfort, worsen at night or during rest, temporarily relieved by movement, disrupts sleep onset and continuity. Biology of restless leg syndrome. RLS is associated with dopamine system dysfunction, iron deficiency in the brain, abnormal sensory motor signaling, genetic vulnerability. Unlike nightmares, RLS is not REM-based. It disrupts sleep before or during early stage. Psychological and hereditary factors. The psychology influence stress, worsen symptoms, sleep deprivation increased severity. Hereditary component: strong familial clustering, severe genetic risk loosely identified, often appears early in life when genetic. The consequences are chronic insomnia, daytime fatigue, irritability, cognitive slowing, increased risk of depression and anxiety, chronic sleep fragmentation affects emotional regulation similarly to nightmares. Both disorders are associated with mood disorders, anxiety disorder, sustained measures, sleep coping, cardiovascular strain, and reduced quality of life. Untreated sleep disorders can worsen existing psychiatric conditions. For nightmares, imaginary rehearsal therapy, cognitive behavioral therapy, and stress reduction techniques. For RLS, sleep hygiene, iron supplementation, regular moderate exercise, and limiting caffeine and alcohol. The treatment will be processing, especially trauma related, SSRIs, depending on comorbidity, RLS, dopamine agonists, alpha 2 delta ligands, iron therapy. Do you know what the iron therapy is?
I imagine more iron
Just
in the blood. I don't know. I've
just
not seen
the pills, iron pills.
I think that would make sense.
Oh, okay. Treatment depends on underlying cause. To reduce both disorders, maintain consistent sleep schedule, reduce evening screen exposure, manage stress proactively, avoid caffeine late in the day, engage in regular physical activity, treat underlying anxiety or trauma, healthy sleep regulation protect emotional function. And nightmares involve REM-based emotional dysregulation. RLS involves dopaminergic and sensory motor dysfunction, but disrupts sleep and impairs psychological health. Moderate hereditary contribution exists in both. Evidence-based behavioral and medical treatments are effective. Sleep disorders are treatable and central to mental health. Thank you.
Anybody else? I think that's it, right? This is classical conditioning. Does everyone remember what these things are? These things have to happen for classical conditioning to work. If you're not sure, I'll walk you through it. Unconditioned stimulus, unconditioned response. This by itself is operant conditioning with positive and negative reinforcement, positive and negative punishment. Neutral stimulus, neutral, very close. Neutral stimulus, acquisition where the learning happens, conditioned stimulus, conditioned response. Commercials love this. They want to do this all the time. So our next assignment is to pick a commercial and analyze it. We probably have time to do it in class tonight. But I thought I would give you guys an example of a commercial that you've probably never seen, and perhaps we can identify these things as a class and then dive into small groups. And then it's just a small worksheet, like 5 questions. So we either present today or next week, possibly today, because I just picked a commercial. Here's my commercial that I like to pick. Obviously not this. Hang on. It's not it. Here we go. Here we go. Panda cheese, guys. What the? All right. Hang on. We'll see.
اعمل لك سندوتش جبنه مع الولاد يا صلاح؟
مش دلوقتي.
ما يتقلهاش لا.
زايد اعمل لك معايا سندوتش جبنه؟
ما يتقلهاش لا.
يعني والله عشان الفطور جايبات النهارده سندوتشات جبنه.
لا والله ماليش نفس. يسوي زي وعيني. ما يتقلهاش لا.
كده مسألة مالك يا عبد العزيز. الوضع ما فيهوش جبنه. والله فوق.
ما يتقلهاش لا.
ايه ده؟ هتيجي نجيب بنا يا بابا.
يا ابني انت ما عملت فيه.
ما يتقلهاش لا.
بابا مش هنجيب بنا يا بابا.
ما يتلهاش طعم.
I recommend getting a genetic methylation test.
So, do you see anything going on here? To buy Panda cheese? Now you're gonna think, this is an Egyptian commercial, by the way. So you guys are, it's from Egypt, so it's a different way in which they do classical conditioning in another country, just to give you some cross-cultural context. But like how you feel about Panda cheese, the humor, the panda, the learning, maybe I should have Panda cheese. You see the panda, you want the cheese. I think that's the idea. So does that make sense? One more quick.
Mike, what's your deal, man? Oh, come on, man. You've been riding me all day. Mike, you're playing like Betty White out there. That's not what your girlfriend said.
Use Snickers. Better?
Better.
That hurt.
You're not you when you're hungry. Snickers satisfies.
That's what I tell people now. It's true. Yeah, I'm like, if you want a Snickers, you're not you when you're hungry.
So the idea is to find, so you go into files and you type in, just individually or in small groups, conditioning, ads. You type in the word ads, conditioning ads assignment. It should come up. It's download. So first, they're both, I think it's in there twice. So you're finding an advertisement, magazine or commercial, and then you're answering these 5 questions. But like the worksheet's fine, but the idea would be like you come up here, play your commercial, and you talk about the 5 questions. Like literally like that straightforward. So what was the product being advertised? That's our neutral stimulus, like it was Panda cheese or Snickers in the examples, right? What was the mood they wanted you to feel with the product? Unconditional response. I'd say probably humor in both, right? How was it product paired or associated with the mood? Describe it. That's the acquisition where the learning takes place. When you see the product at the store, what does the advertiser want you to think of? Conditional response. And then whether it's your ad or just in general, have you been conditioned by classical conditioning in terms of your product purchases? Why or why not? Does that make sense? Take a few minutes. This probably takes maybe 5 or 10 minutes. You could probably show us some commercials today. The plan was to do that, and also, which we can do next class. We're going to tell you guys, and also files. Yeah, but we'll just start with that one. So you guys want to work in small groups, and like I said, it probably is not going to take the end of class to come up with some ideas. So we could probably present a few commercials before we call it a day. But you're just finding a commercial. Maybe tell us which one you're doing or write it on the board so we can all do the same one. And you're just answering those questions as a group. And then everybody should email me so it's easier for me to track, but it can be the same document if you guys share. You're just going to come up here, play the commercial, and then answer the questions. Literally that easy to enrich your understanding of classical conditioning. So pick groups, work individually, wherever you want to do. If you want to do a magazine ad or a print ad, that would be okay. It does not have to be a commercial. So 3 to 4 a group, 1 or 2, however you all want to do it. Just make sure everybody separately emails me something so I don't have a grading nightmare. Like if it has your names on it and it says the same thing, it's okay. I don't have to guess which groups at the end of the term. Just one ad. But you should all email me individually, even if it's the same sheet of paper. Just one ad. And please write it on the board or tell me, just so we don't have you all do Snickers or all do, so when you come up, they're different. Just It's first come, first serve. It's just if you pick Nike and they pick Nike, I'm gonna say one of you guys can pick Nike, okay?
Okay.
Oh, wait, I'm sure yours, my bad.
No, I just finished it.
Oh, okay.
No, it's okay. It gets easier over time. Yeah. I used to be really scared of like I used to keep like we very
Used to scare me too, Kate, and it doesn't at all. This.
Oh yeah. But you got used to it, right?
Used to.
Perception. Anxiety,
Yeah, just immersion. I had a job as a professor, and I didn't want to not be a professor because of that freaking me out. So the first time I taught was
It's like no limits. Like you put your own limits.
yeah, it was totally nerve-wracking the first time I did it for a 6-hour class, not a 3-hour class. But
That's different.
doctoral students, 30 half of them had taught.
I think it's the. Oh yeah, yeah, yeah. Yeah, that was a good one.
So write it on the board or tell us or something. Just have a way to communicate so we don't do the same ad, guys. So like, we're not doing Coca-Cola again because we got it on there once. As long as it's appropriate for class, it is college. 99% of what you guys come up with would be. If you're concerned, run it by me.
Okay.
If you're like, hey, I don't know if this is appropriate, ask me, and I'll tell you. Oh, I know which one that is, I think. Is it the one with he's in the middle of the night?
Yeah.
Yeah, Jake from State Farm and his wife's all pissed. Yeah, I know what you're talking about. I'll be right back, guys. Did everyone find that?
Yeah.
Just keep writing your stuff on the board if you're selecting stuff, guys, so you don't duplicate your efforts on your columns.
No, sorry. Oh, so he used Pepsi, he used the Coke to set together Pepsi. Because it's worth more?
The one with the,
Better?
like the classic one where.
Because there was like no like scenarios. Like this one? Because this is what I think. The
where someone's calling, and then he's like, oh, who are you talking to? It's like, oh, it's like Jake from State Farm. Like, what are you wearing?
I knew that was a great thing.
I think that is the one. Yeah, it is that one.
So you're married teaching, and then I'm not married because I took Wait, wait, don't tell me, don't tell me. Because you look like you're 20. Is this not because my yeah. Wait, how old are you? I literally thought you were like 23. Like, you were with me when you were 23. I'm just now.
Because any commercial, he does just like
Girl, your skin is clear.
But what about you? Because he does show.
You have to download it. But I know that there's that other one that starts with K. Where did you meet your man? You were in Seattle? Really? Did you really like it? Isn't it like I love the rain. Yeah, it's like I mean it's kinda gloomy, but I feel like I prefer that over like but it doesn't say nothing. It says
I'll take exhibitions.
where?
You gotta do the presentation, right? For the drugs and stuff.
Yeah.
You wanna work into it? Although I wasn't.
I didn't know.
What was it? perception.
Oh, we're gonna choose that one. We're gonna choose that one. No, we can.
Because what?
I don't see them anymore, but you know which one was funny?
That's fine. We were actually waiting for this. Are you still thinking it's okay? Just don't do full of Pepsi or State Farm.
Okay, we won't do that.
So type in ads, top page, type in ADS.
Oh, 15.
Click on that. Click that. You're answering those questions, so it either opens or downloads. It's just 5 questions. So you're gonna show us, probably like a link, show us the ad, and then you're just gonna answer the 5 questions.
There's this one. I don't know what it is. But I watched it when I was a little girl.
Armier? Okay. I think I know which one you're doing.
Yeah, or the one that was like, it was like I remember because my mom bought it, and every time like we would buy it, she would laugh, and it was like they would be like a janitor, and so I was like, quítate, like or something, and it was just funny, and I think about it a lot. Every time I treat that like that.
So we're gonna do the Super Bowl Lays commercial.
Perfect.
What's the name of that? Is it Harvest something? Well, we don't need the name, right? We don't need...
I just need to know what you guys are doing so no one has the same thing.
That's Harvest.
It was like a janitor.
Oh, Serena is doing it? Okay. Okay. Okay, cool.
I like that one, yeah.
The answer number 1 is insurance. I think we just
No, just answer the question on the worksheet. Like I want you guys to show us a commercial, but you can just read them. You can be informal, but then like for emailing me, just like email me the worksheet. But everybody should email me even if it's the same thing, so I don't have a grading nightmare later.
Oh, just
It can be the same document, but I should get an email from every one of you, so that way, when I'm checking, I can be like, "Oh, Jen did this." Like I'll know you all did the thing. Otherwise, I gotta write stuff down for all the group. If you all just email me individually, it makes it way easier. Just now? Sure. Yeah. Probably. Yeah. Yeah. So those can still count because they came in once we knew. So that's fine. I just didn't want you to be like, "Oh, I'll email you in a week." And I'm like, "Well, then that's not fair."
I think it's the second one too. It's just the feeling of frustration. It's part of like all like these companies suck.
Yeah.
I was asking.
Can we do like 9, 10?
We can do like 9, 10, but then we're gonna do like 1 or 2, maybe 3. No, that's fine. I'm just.
Okay.
We can do 10.
I'll try to hurry up.
I don't want pressure. It can be.
No pressure, pressure,
It can be today, or it can be next week. I just feel like they go fast, but I'm like, if we can have a group or a few groups present right there, then do it.
Yeah,
If we
to get
can't,
us the
and you
link.
all need from like,
No, that was the other one.
Okay.
That was like the competition
Okay.
basically.
I don't want you to rush. I want you to get the answers right. Okay, so.
Are we doing this one and the other one too?
That's why I feel like number two.
Yeah, we're gonna do.
Where's the other one? Homework.
The other one's homework.
Okay.
The other one is operant.
But like, it's like, oh, like, well.
Just type in the word operant.
State Farm is, you know, your guys to go to.
And then you're classifying those.
Okay.
Or we can do that in class next week. Or we can do that in class next week.
Why don't we do it and then we just go over it together? To
That's
see where we're
that's
at?
usually what I do. I usually go over it with you guys, so it makes sense.
Because I mean that
I
shouldn't
feel like
take
we
more
should
than
do
30
that
minutes
next
for
week,
anybody. I
and
would
then
think.
do what we're doing right now.
Yeah, I could work. But usually for learning to happen, Kate, what I usually have you guys do on your own, and then I walk you through it. If I just tell you, you may not
I
stick.
think so.
Yeah. Just kidding.
No, it doesn't.
No, it doesn't though. Yeah. I like when we talk about it the next class. What's your high school anyway?
How are you guys pacing?
Around 4.
Oh. So maybe you can present something today. Maybe. Our goal is to go 5 or 10 after or next week. Because I don't want other groups working and missing the stuff either. So.
I think 5, we gotta work.
And on 5, I would definitely want to hear from everybody in the group. Like, type 2, you, like, everybody should have a part. I'll follow you. After question 5, I definitely want to hear from everybody in the group. Like, whether you're affected by your product you chose or just in general. So if you're like, hey, I buy shoes or clothes or whatever it is, and then you, like, different examples, or you can all talk about the product, but I think 5 should have an opinion of everybody.
Yeah.
You can do that. For 5, and whether it's product you chose, or you're like, hey, I buy this shoe all the time.
Yeah,
Like,
we
yeah, okay, cool, okay. So you guys can go.
Technically, I mean, but if she wants to put make a better.
Okay. Okay.
Alright.
Or we can go to. We'll either have a few go before the end, or we'll have everybody go to the next class.
Oh, Google
Kind of
Doc?
depending on how everyone's pacing. Are you pacing?
My computer's super slow. I had to restart it, so I'm trying to work on it.
Okay, good, we hope you find it. You know where it is and everything?
I think I have.
Okay.
Yeah, thank you. Are you gonna make it happen? Will you do it?
Is this one group?
Yeah.
How are you guys pacing so far?
I don't know how to answer 5.
You're done? Maybe we'll have a group.
To be honest, I feel like, I don't know, like, I think I have been influenced in that way.
Right?
And not that I feel either, you know what I mean?
I feel like it's harder because it's personal and like you don't want to feel like you've been conditioned.
Oh,
Right,
yeah.
right,
I used to ask her, huh?
And then you have to search for the things, somebody directly.
I feel like a good example, I guess, would be like if you saw an ad or something and then
I mean, I don't think that's like the general, like, for sure.
Oh, yeah, we're associated with
Maybe
that.
like excitement.
of like the ad, I guess. Or
Curiosity.
like
You
a
did
feeling
say,
from the ad.
like you did send it.
For you to ask her
Probably,
questions.
you can always
I can't
send
think
it
of anything 'cause I hate
to
ads.
one document.
Yeah, I always press skip.
I just gotta, when I'm looking,
I'm
I'm
not
like,
gonna lie,
find
if I see an ad for something, like 9 times out of 10 I probably won't buy it.
Yeah.
This is how much they annoy me in that one.
The same one's okay.
I don't know, sometimes they get me though, lucky, like on TikTok, when it's like clothing, and then sometimes, just I look at it.
I get that. I get that.
You're gonna present it, you're gonna say, here's a commercial, but you don't have to have a slideshow.
I feel like I'm wrong, but I think I'm gonna put no for 5.
You just read your questions.
Yeah.
You're like your answers, like, yeah, it's like more informal, so the idea, like, it always goes quick, so my idea was either you present a few of them before class ends, or everybody presents next week, because these go pretty quick, like, it's probably not even
Yeah, it's
homework,
boring
because
enough.
you're just answering those questions, but on 5, I do wanna hear both your opinions, like,
Yeah.
are you influenced class, and are you as well? Whether it's a product that you've chosen or just in general, if you're like, yeah, there's this shoe or this brand that I buy, you can talk about that at 5, but definitely want the opinion of each person in the group on 5.
Sorry, which one?
Thank you. So I put
Not a
frustrated,
slideshow, guys,
and then I
just
put like
the worksheet.
these other companies.
Like, you know, when you know the link, cause your YouTube might not be mine. And then we're gonna click on the advertisement, and then you're gonna show it to us, and then like play it, and then you're gonna answer the questions verbally, in front of your peers. Literally that's it. Or just, okay, yeah. But they're short, I mean.
But I think for the other ones, I think we could probably just come up with that if we wanted to for like just piggyback off what we're saying. Because I think we do have a few more partnerships.
The goal is to try to have a few people keep it on with their commercials.
Do you want to see it? Information? Yeah, of course. Get it out.
So I did send you the link to our commercial.
That's perfect. So what you do is you just come up, we click on the link. Here's our commercial. Here's our answers. Here's our thoughts. That's it.
I feel like they're pretty short, honestly.
I've done these as PowerPoints, but I feel like saying it verbally is probably sufficient, you know.
Probably not then.
Anything in the DSM would be fine as long as you didn't see it tonight. Because the idea is not to duplicate your classmates' efforts. We all learn different stuff.
Anything in the GSM, if I find something outside of that, would that be okay as well?
Probably not, because it needs to be a real sleep disorder. The DSM-5 has all of them.
Oh, but you already shared that to us, so that's fine.
So you guys have it. There's like lots of sleep disorders. There's a link, and then it's the 900-page manual, and every sleep disorder is listed. If you absolutely can't find a sleep disorder, you can do it another mental health disorder. But ideally, I would like to stick with sleep. That'd be our backup plan. If you're like, they did all of them, then I would say, okay, tell us about anxiety or something else mental health related.
You had emailed us the
I think I put in the announcements.
Oh, the announcements, okay.
I think there's an announcement link that says DSM-5, and then you just click on that, and then it loads a free one, PDF.
Thank you.
Yep. Is it safe to say that maybe in a few minutes we could have a few groups present? Is that realistic, guys? Okay.
Yeah.
Okay, because they're pretty quick.
Do you want the fourth one to be our whole group or like a whole group?
The fourth one is just what you figured out as a group. The fifth one's a whole, everybody, individually. Because you probably would agree on question 4 as a group,
Yeah.
right?
I guess.
If you would have told me earlier, I could probably address that. Now it
No,
would be
I
late.
just started feeling some like my hands so cold.
I make them turn the heat on and off and the air on and off all the time at my day job. There's actually been emails about not hassling the leadership about that, and I continue to do it because I want my students' comfort to be valued. And if you guys are super hot or super cold, I'm gonna
Appreciate that.
push the envelope. So, but now with 8 minutes left in the clock,
Yeah.
by the time they come up here, you'll all be leaving. So, our plan is hopefully at like 9:10, have a group or two come up and walk us through something, like do a commercial or two. Maybe not all, maybe all, depending on time. But my goal is try to get you out of here on time if at all possible. So, yeah.
Oh, as far as
And I'm sorry my email response is late. Is because it came through Canvas. I think I missed it versus it going through.
I saw how many you get. I figured.
Yeah, if you'd send it over email, or texting. Texting is okay too. You all have my phone number, so texting and calling is also okay if it's like more urgent. But generally, I'm in my emails every couple of days at all schools or every day or two. I never go more than a week on email, but I usually try to do every school every second or third day in a row.
Gotcha. For the drugs, it could be any drugs.
Any drugs, legal or illegal, doesn't matter. Something we didn't see tonight.
Yeah, I was trying to write them all down.
I did record too, so
The recording will be.
I can make it available as early as tonight or tomorrow, no problem. It basically has to save it and then I have to upload it either to YouTube or to Canvas. If Canvas won't let me upload, I can upload it to YouTube and provide a link.
That's fine. If you could just please send last class as well, please.
Yeah,
Thank you so much.
no problem. Can you? I think I'll remember. Can you shoot me an email reminder or a text? Either, just so I have like a cue to be like, oh, here we go.
What was your email again?
jmac1@waubonsee.edu. Waubonsee.edu.
Would wonder kind of tie with curiosity?
Yeah.
Can I send it through my email?
Yeah, as long as they can follow the link, that's fine.
I tried linking things, but they don't work, and I'm kind of crazy, so I had Ziki help me from my website because it wasn't linking anything. And I don't know why. And I just tried to email you too, but it wouldn't create an actual link for it. I don't know if
You
it's
can link or you can download the file.
for the commercial.
Yeah. How are you guys ready?
Yeah, James just needs to do his part for the question of time.
Just search for the commercial or provide the link. Sometimes it's better to cut and paste the link because sometimes your YouTube's not my YouTube. And so as soon as come up there and they're searching and searching, I'm like, you just sent me the link, but I found it right away.
Can I just tell you what the email is?
You can.
So just type that in for you and that's it? Yeah. And then you can find it so that
Oh, that one's probably, that one's classic. Are we able to present or are people still working? If people are still working, I don't want you guys to miss stuff.
We good.
If people present, can you commit to not work, or is it better just to be ready and do it next class?
What did you put? I put no.
Because otherwise we'll miss your stuff. If you're ready,
Yeah, we're ready.
and you send me stuff, you're
Yeah, we already did.
you're free to go. And
Oh, okay.
We'll do the last couple minutes, people that want to rush stuff up if they have questions.
That works.
Do we have to email you the?
Yeah, I think what I'm gonna do some sort of working version of present next week, so take the last couple minutes, wrap up, have a plan, etc. But be ready like tonight to present, so then when we get here at 6:30, we're gonna come up for maybe 10 to 15 minutes tops, or we're just gonna walk through commercials.
Yeah.
And what you guys come up with.
Might follow you first, or
And if you don't finish in the next few minutes, have a plan to be finished with your group of people. And we'll do that to operate conditioning stuff, and then we'll segue into memory.
So we're just doing operator.
Yeah, we'll do it next week.
Oh, in class?
Yeah.
Oh.
Is that easier?
Yes.
Well, easier to take the stress. Lower the stress.
I have a little question. So, I was taking the humanity class, and I'm taking it's called Global Village. And last week, so now they're in Africa, and they put it as an assignment. And which we had to watch some videos and do a discussion questions about it. So we had done it for every region, but this now, the professor picked one about force-fed women, children in Mauritania, in Africa. Like the girls, they're being force-fed because they're apparently culturally that is acceptable for them. They find them more beautiful if they're fat or whatever, and they want to get them married. But the teacher said that we have to apply suspending judgment to watching the video and do the discussion about it. So I watched the video and I flipped out about it.
That's not suspending the judgment.
I know. That's why I couldn't suspend my judgment. Like there was no way that I could continue watching a video where something that Miguel had 3 girls.
Thank you, Professor.
Like in my personal, I said nobody. I said I wish I would have never seen that video. You know, like I wish I don't want to know about this because there's nothing I can do about it, and because I can't just play the game of suspending my judgment. You know what I mean? Like it was kind of So
I know
I
what you
emailed the
picked, but I
professor
don't remember.
before the submission and said, hey, I'm actually struggling with
Gotta find
this
it either way.
because how can I really do this
The
with my circumstances?
Oh, like the YouTube?
This is like, I can't just ignore it. And while I'm watching the video, it's still happening right now. She never replied, and I felt like very kind of disappointed that hey, I'm pointing out something that, yes, you can play a game, whatever, but you're already talking about real people here.
Yeah.
And I said, my thing that I found it more problematic was that, what was the purpose of the recording itself? Why somebody wants to do a recording about that? There was no fixing about it, there was no changing, it's just them recording for this unreported thing. He said, what's the purpose of something like that? How that helped me? How am I a better person because I know that these people are doing that? 3,000.
Because you have cross-cultural competency.
But the thing is that there's no, that's what I'm going to say.
Because what's happening is you're getting involved in ethnocentrism, thinking your culture is superior to theirs, and that's why it's bothering you.
No, when I
both
say,
cultures are right, even though you don't agree with it.
but
It's
that's
hard.
what, oh yeah, but that's
That's
but I
very
say
hard.
like, yes, it is true that both cultures are right, but if both cultures are right, I don't need to know about that one.
But if you were raised in that culture, you would believe it like you believe against it in this culture.
But true is that
she's trying to illustrate cultural relativism. What's right? Because like there's a very tribal culture right now, and one of the things for the coming of age for the men is to kill another man like tribally, and that's what they do, and they don't go to jail. Like I totally believe murder's wrong, the way I was raised, my morals, my principles. But for that culture, because they were raised from day one, that's their truth.
And that's okay, but what I'm saying is like, were you not really helping by you knowing that that is happening? What is it? What are you really, how are you a better person because you know that it's happening over there? You're not gonna change it.
But you have more awareness.
But what's the purpose of moral awareness when you know that something is happening, you can't change it?
It would probably up your IDA. It's something called the intercultural development scale, and we always get that wrong because of our cultural sensitivity. We're usually like a level or two below. I can send you a link where I can pull it up on the board and show what I'm talking about. But the problem is, what ends up happening is,
No, this is a very dangerous instrument. No one wants to use it because no one likes constructive feedback. Intercultural development inventory. So this is a really great instrument, and let me see if I can show. Who uses it? Hang on, there's like a. Yeah, so this is where we are. So denial misses the difference. Judges different polarization. I think that's where you might be. I'm not judging you. Like, we all struggle with this, okay? Minimization de-emphasizes difference. Acceptance deeply comprehends difference. Adaptation bridges across difference. You're definitely not here. Or I can play the short. It's like 234. It explains it. Do you want me to?
You can send it.
Or I can send it. This right here is what she's trying to do, and we all think we're here. Everybody in this room wants to be here because this is really the best. It really is. But usually, the way the scores are, you have like where you think you are and where you actually are. Usually, you're one or two below wherever you think you are. So if you think you're adaptation, you're at acceptance or minimization. If you think you're usually one or two lower than, and she's trying to increase this for you, even though you don't like the activity. That's probably what she's doing.
Yeah, and again, what I saw, and I said one of my biggest, even worse than the cultural thing, is that the act of me going, like me the reporter going there, recording that happening, and pretend we knowing that for me that's not normal. Pretend that oh, I'm just recording. When you're looking at 10 years old getting sick of the kill for something you so the purpose of the recording of the reporting is not really to maybe create the awareness, but maybe just to fulfill that fetish of seeing something new. And that makes me upset because this person, she tried the diet with the girls and she couldn't last breakfast.
Oh.
So a grown-up woman try this stuff that is damaging a 10-year-old, and she couldn't last breakfast, and she continued doing the recording. She sat down in a corner, she threw up, and while the kids were forced to keep eating.
And we know with medicine that that's bad, and we know we have some science in our culture that informs that's a bad idea. That culture does not.
But that's the point they will show that they do know that is, because they will go into the city and buy medicine to even make it even worse.
And that's the problem with culture. Culture is incredibly hard to break. It's based on centuries of tradition, and breaking culture, even with a well-informed, what you just said, like the science, like this doesn't make any sense. Breaking culture is incredibly difficult to do. And I'm with you. Like, if we know it's bad, let's change it. But changing something cultural, it's not that it can't be done, but it's very hard to do.
And it's like, if I never knew this, that's it. I wouldn't go to bed thinking about it. You know what? Because definitely ignorance is bliss, right? If that's happening over there, I'm not gonna go to war with Mauritania to make that change. That's not gonna happen. Me personally, I'm not gonna go and be an advocate for those girls. I can't do it, or I don't have the purpose to do it. But the fact that I saw it made me so upset, because I did not consent to do that. I did not say I want to be exposed to a level of a traumatic experience like that. It was unnecessary. That's what I'm saying. That's how I see it.
The only other thing I can say, I remember a professor said this to me a long time ago. He said, good art moves you, and if it moves you emotionally or upsets you, it's changing you.
Probably, yeah.
Which is a hard one to swallow, because you're like, I still think I shouldn't have seen that. But she's trying to get you outside your comfort zone and make you think about it cross-culturally, even though we know with medicine it doesn't make any sense. You can't, culture's so hard to break.
Yeah.
It's incredible. And that's something that I've asked my psychology classes in the past. There's a video talking about the power of vulnerability we usually watch at some point in class. Would you commit a social faux pas if the threat, or not threat, if the idea of happiness was possibly on the other side? Would you break a strong, I'm not saying the one you mentioned, but would you break a very strong cultural rule if it might benefit you or someone you care about, if it's cultural? Because breaking culture is so hard to do. It's a Socratic question, but it's not hard to answer, because we have to have some context. Like, this is the thing you know your whole life, and they know. But that's what she's doing. But I hear what you're saying. I've never watched Final Destination, because I have some friends that have been like, you don't want to see it because you'll always think about it.
That can happen to you, right?
Yeah.
Wow. Have a good night. Thank you.
Question. All right. So for spring break, it's wherever that is, 16th to the 22nd. For the homework, 16th to the 22nd. So we have chapter 8 we gotta have done, midterm, and chapter 9 and 10 done for all spring break.
I thought I made the dates not fall during spring break. Do they? I think they fall before and after.
This is due to 16th, so the day of when spring break starts.
I can move that closer. And I can move these down a little bit. My goal was not to have you guys do anything during spring break.
Okay.
I'll go back and look at those.
Okay.
Before we get there.
All right.
It might be this weekend, but I'll do it.
All right, that's fine. Cool. Thank you.
Yep.
I just wanted to check if how much homework if we had any to do over spring break. So
It might make you have to do more before or after, but I'd be willing to move those so you guys can just enjoy your spring break.
Because I don't mind doing the homework over spring break.
I'm trying to let you enjoy the spring break.
Yeah. Okay. All right. Okay. Cool.
For next Monday, I think I have orientation for a new job at 6. So
Oh.
what can I do?
So I usually record everything. So I would say whatever we do, you would do. A lot of times, what I can do is I would like to have any way to prove you have orientation. I totally believe you, but students have made stuff up before.
Sure,
and then usually I say like, would you be willing to like watch the recording and like maybe write down like your thoughts, or like if we had some conversations, your thoughts as if you were weighing in, something so that could be like in lieu of class.
Oh, okay.
something like that, I would try to work with you. The other option would be if your orientation is short, but it's far, possibly attending on Zoom, but I want to be very careful with that because I don't want to start lecturing to an empty room. Like, I don't want you all on Zoom. Because there was once where, like, one person was going to show up and I was in the group chat. I was like, are you sure? He's like, no. I was like, okay, cool. Because it was really, really cold out. So those could be some options so you wouldn't miss it. I get it if it's work.
So that's the only time day. I mean, it's not gonna be every Monday. It's just orientation day.
It's just one, yeah, so I would say go to the orientation. Can you get some sort of, just something that proves you legit told me that, because I want to believe everybody, but I have had students make stuff up over the years. That's why I'm like, show me something so I can be like, okay, that tracks. And then I can work with you with an alternative assignment or like watching the video and like writing like a summary or something so I know you legit like watch the recording. Like enough information or like answering the questions that were posed in class or telling me your thoughts, something like that. I could work with you.
Okay. Because of the presentation also that we were supposed to do. I mean, I wrote down my
Could you email? Oh,
because we didn't get to present today, so.
just email it to me before next time your group can do the presentation on your behalf. That's fine.
Okay, sure. And then for the Zoom, like recordings, where can I find them? In the files as well?
I can upload stuff. I don't know if I've uploaded this term. I've been recording all term. I have them on my computer. I don't know if I've uploaded. I can put them on Zoom. It's no problem. I mean, I can put them on YouTube,